Hi everyone, so my name is Kendra Joy Trujillo, and today I will be talking about racial disparities and maternal morbidity. Unfortunately, the United States is the only developed country in the world with an increasing morbidity for birthing people. I say birthing people to be a little bit more inclusive. I know that this is maternal morbidity, but historically that is the name. And a lot of the studies that I've chosen today especially include women, not necessarily birthing people, so I'll kind of interchange that throughout the presentation. And so that is especially true of those birthing people of color. So Black, American Indian, and Alaska Native birthing people are 2 to 3 times more likely to die from pregnancy-related causes than white birthing people, and the disparity increases with age. So that's kind of our bread and butter of the whole presentation. So most pregnancy-related deaths are preventable. That's another main point that we're going to be talking about. Racial and ethnic disparities in pregnancy-related deaths have persisted over time. It's not a new issue. This has been a historic issue, and it continues to be one. So this is a better view or a better image of that, what I just mentioned. So this is a visual representation of that. So non-Hispanic Black birthing people have a much higher maternal pregnancy-related morbidity and mortality compared to those who are not Black. So that's kind of what this explains here. This is another visual representation of the increasing morbidity and mortality of these women or birthing people from 87 to 2017. So you see it's at an upward trajectory, which is really sad thinking about the technology and the medical advances that we have had since then. So what are the causes of these deaths, of this mortality and morbidity? So cardiomyopathy, so we have some issues with the heart, some pulmonary embolisms, so that is an issue with the blood and hypertensive disorders. It's the issue, an issue with blood pressure, hemorrhagic disorders of pregnancy, so any sort of hemorrhage within pregnancy, and implicit bias, which is what we're going to be discussing today. What is implicit bias? So the actual definition are the thoughts and feelings that exist outside of conscious awareness and subsequently can affect human understanding, actions, and decisions unknowingly. So we talk about race a lot and racism. This is something a little bit different. This is something that is outside of conscious awareness. This is something that is learned but not necessarily thought of as racism. This is something that is just a bias. So your stereotypes and your previous understanding of different races and different ethnicities. So this is important to understand, and especially important when it comes to how people of color are treated differently in society. So why does this matter to me, and why does this matter to you? This needs to be addressed because these deaths are mostly preventable. We talk about a lot of the cardiovascular and pulmonary issues related to pregnancy. But we also have to understand that there is an epidemic when it comes to people of color having historically those issues, not only because of racism and racism in workplaces racism outside of workplaces and also systemic racism. So things like education, access to healthcare, those sort of things. But also the fact that these things also affect pregnancy and also affect infant and fetus mortality as well. So this affects people of color. So people of color, um, being in New Mexico, where there's a large diversity, when you go to places like Appalachia and other um, more rural areas, those have a higher um, variety of people, and it's a lot different than it is here. So this is a public health issue. People are dying, and it's an issue. This is why um, this is an issue, because people are dying. It has a huge effect on our healthcare system. It costs a lot to have longer stays for these birthing people, and it is very taxing on our healthcare system to try to treat issues as opposed to preventing them. So this is not only a problem for those who are giving birth, but the fetus and also for the infant. And so this is another visual representation. It's a little bit wider of a range of different types of people. And it's also quite some time ago. But you see here, this is the non-Hispanic blacks, infant and fetal and preterm births. They are so much higher than almost any of them. Close second is Puerto Rican. So this is a large problem, especially for fetuses and also infants. So what can be done? Acknowledging that there is a problem with implicit bias, acknowledging that these people are at a disadvantage because of their skin color. Training staff in understanding implicit bias and how to provide proper care for patients without stereotypes. So without stereotypes, understanding that because a patient is Native American or Black or Hispanic, that they shouldn't get treated differently just because of those races and those ethnicities. So including implicit bias as an issue in healthcare training like nursing, PA programs, and medical programs. So this is important to attack the implicit bias before it becomes an issue in the healthcare system. You want to take steps to understand and correct it before it enters the healthcare field. So that is an issue with training staff, training CNAs, training housekeepers, training medical staff, any sort of medical staff, that implicit bias is an issue. And so this also happens a lot. I know it happens, especially at Presbyterian, where there are inclusion and diversity trainings. And so those are really important. And so I think continuing in that direction and having more hospitals and having more of those clinical and healthcare settings increase that kind of diversity and inclusion training is really important. So focus on the person and the individual care for those already in the healthcare system. So we're talking about the doctors, the nurses, the technical staff, the clinical staff that are all in the healthcare system now. And it's important to focus on the person and the individual as opposed to the stereotype. So another thing that can be done is including those trainings and just keeping an awareness for implicit bias. So if you have any questions, please reach out to me, questions, comments, concerns, and this is my resource page, and thank you very much for your time, and have a great day.